Hey everybody. So I just want to talk about a couple things from yesterday. I was sort of up in the middle of the night last night thinking about Mackenzie, and she was sort of the first thing that popped in my mind this morning because her case really worries me for a number of different reasons. And I just wanted to kind of like clear that up because one of the first things that she said was that PT, what did she say? I failed PT. Okay, so I failed PT. I failed PT is something that most people don't come up with on their own. That's not a saying that most people say, right? It's usually something that a doctor will say to a patient when they want to justify moving forward with a surgical option or another procedure. So I just want to throw that out there because she did not fail PT. Her body did not fail PT. PT failed her. Okay? PT failed her. The PT she saw, not that the person's a bad person, but the interventions that they chose based on their assessment was not helpful. That does not mean that she can't find another PT or another provider that can provide a very helpful outcome for her. So just want to throw that out there. I get worried when I see people sort of spitting back language that it seems to come from their doctors who sometimes have an agenda of their own. There are a lot of physicians out there. Sorry, my dog is like going crazy. There's a lot of physicians out there that have agendas. They have research they're working on. They have something that they want to make a name out of for themselves. So whether it's brachial plexus, nerve entrapment surgeries, or whatever, they want to take this case on. This is a big case for them because this is exactly who they want to try to make these changes on. However, there's so much more to a human than what people can put down on research. And in this particular case, Mackenzie has very obvious hypermobility issues. She may even have Ehlers-Danlos. I don't know. She needs to get some genetic testing on that. And I have sent her an email giving her all of the resources for that. But there's something, I believe, there is an underlying condition that is complicating her body's ability for this nerve to heal. And it is also creating a situation of more instability throughout her system because of an underlying hypermobility issue. And the more, like I said in the video, in the case study yesterday, the more parts that you remove, the more support, the more structure, first rib, scalene, possibly pec minor now, the more things you start to open up and free the nerve up, the less protection there is. And then when you have somebody who already has that increased laxity in not just the muscle tissues and the ligaments, but the nerve itself has extra stretch to it. So all the tissues with hypermobility have extra stretch to them, but they don't necessarily rebound back. So think about like silly putty, or if you don't know silly putty, like slime. Like when you stretch it, it stretches out far, but then it doesn't recoil. It's not like an elastic band. It doesn't recoil back together. It just kind of stays stretched. And so that, I believe, is sort of what's happening with her nerve. It's like stretching out. And the weaker she gets in that shoulder, the more it hangs, and actually the more it stretches out. So not strengthening is like only making it worse. Sorry, I get so like, I almost cry, like want to cry because I get so pissed sometimes about this stuff. And it's just making the nerve be even more stretched. And nerves don't like to be stretched. Nerves don't like to be like tacked down one place and then overstretched in another place. All right. So they don't like that. And they give people crazy symptoms like what she has. I mentioned in the video in the case study yesterday, a concern for maybe some cervical involvement with her neck. When you have someone with like that scapular pain, radiating pain that she has in the scapular area, oftentimes that's radiating from the cervical nerve roots. I don't know if I made that clear, but what I am concerned with, she has a very long neck. She has that instability, and there could be something going on with the nerve roots in the neck. So she needs neck stabilization. So instead of taking out her freaking scalenes and destabilizing her more, she needs strength. Like, come on. I'm getting fired up. I need to chill. All right, but this is, these are the things that keep me up at night. These are the things that I just want to follow up with you guys, because it is very frustrating being a provider, either in rehab or in a training setting, when you see a patient going down rabbit holes that you just sense in your heart and your gut are just not right. And feeling kind of helpless, like there's nothing you can do about it, because they're so convinced that these doctors are going to fix them. And, you know, they come from these great, you know, science research driven hospitals, and this is the best of the guy, and he knows brachial plexus and he's going to fix me. And they're not looking at the full picture. They don't understand how the human body moves. They see a scalpel, they see a human, they see a nerve, they fix it, and then after that they're done. And it's messed up. And this poor girl who's 25 years old is left with this feeling. And she told me in an email before we got on the call that this is her reality, and she has been left disabled by this. And she does have a disability now. She has lack of function in that hand right now. But there seems to be this like permanence in it, where the doctors are sort of like, you're disabled now. And the only way that we can fix it is to do this surgery. And I just don't see that as helpful, not only physically for her body, but from a mental health standpoint. It's just really makes this dog, like, leave me alone. It just really makes me sad for her. So I'm trying to think if there's I'm trying to think if there's anything else from that video yesterday. I will probably send more out if I think of it, but right now that's all I got. Yeah.